pain. So for pain medication, any medication, always ask your pediatrician. Even if you are a nurse, you are a healthcare provider, always impart your physician's directions. Our pediatrician gave us this list to follow, and that is for acetaminophen. Tylenol is the brand name, and this is for ibuprofen. Motrin is the brand name. She strongly said no Motrin before the baby turns 6 months. This is how they look. For Tylenol, there's two kinds. There's one for infants, which you're seeing right there, and then there's one for 2 years and above. Okay, so for all the medications, by default I always look for the active ingredient, and in this one is acetaminophen, 160 milligrams per 5 ml, and they usually, most of these have like an instruction at the back of the box with the active ingredients. For most of these, they always let you ask your pediatrician. Incidentally, which I have just realized right now, the one for 2 and 11 is also 160 milligrams per 5 ml, but I think because parents used to overdose, they kind of just make one less, and even just the accident of kids overdosing. So keep all the medication away from children, locked up away from their level. But as you can see, this is the one for the infants. They give you a syringe, and you know, as you can tell from the pounds, so if the baby is just 0 to 3 months, it's 1.25, and we have a 1.25 line. If the baby is 12 to 17 pounds, and they could be within that pound range, or they're within those months, 2.5. You see that 2.5 line like that. And then for the older kids, which is here, children Tylenol, they start with 5 ml, 7.5, and all that, depending on the age, as you can see, and the weight. So that's the one, and it's bigger, and it has a cup instead of a syringe. And so for the Motrin, as you can see, that's the syringe, and the syringe also has some inscriptions: 1.875, 1.25, and 0.625, and it will tell you per pound how much to give. So our pediatrician said don't give before 6 months, and as you can see, 0 to 5 months, nothing. 6 to 11, 1.25. You come to your syringe, and you look and see 1.25, right? And so with this one, the active ingredient, like we said, is ibuprofen, 50 milligrams. It's an NSAID, which means you need to feed the baby before you give it to them. Even as an adult, do not take ibuprofen before you eat something, because then you're standing a risk of having peptic ulcers, which we don't want for you or the baby. Yeah, so ibuprofen, I have not used with my kids, thank God. I haven't needed it. As you can see, all these are still new and sealed. The kids have been healthy. I continue to cover them under the blood of Jesus, so they'll stay healthy. But parents say this is really good when the kids are teething, like a 6 months and more. Sometimes because it's an inflammatory process, this is usually a good one. Tylenol is very good with fevers and pain, aches and pains, fevers. It's really good. But like I said, everything, ask your pediatrician. So this is our pain section, even for teething babies, because that's when there's discomfort. You know, I'm going to show you another product called Camilla, which is what we use. There's so many other products out there, but that helped us, and so we would use that topically, and then before this one kicks in, you give this one, and while it's kicking in, we'll put the topical one on the gums. Right, that's for pain.